Hi, I'm Suneel Chilukuri, board certified dermatologist in Houston, Texas, and I'm excited to share some data and some perspective from a board certified dermatologist to you and the public as well as our colleagues. One of the biggest conceptions or misconceptions that we see from coming forward-facing patients is the fact that you need to actually moisturize when you have acne. A lot of times people are trying to dry out the skin. They say, "Oh, I'm so oily, I'm producing too much oil." And what we find is this cycle. And when we're trying to dry out the skin, the body is reading that as the external barrier is very dry. You have to produce more oil to actually correct that. What ends up happening with this vicious cycle is then with all the oil that's being produced, you're going to actually get more blockage of that follicular osteo or the pore. As a result, that leads to that bacteria that's growing inside at the base of that follicle, and then that leads to both inflammatory, comedonal, and genital papular acne as well. So the biggest misconception, in my opinion, is not moisturizing. The best thing that you can do is find a product that's going to allow you to have a non-comedogenic moisturizer that's built in. Some of those products include moisturizers from a company like Penoxyl. It's something that's very accessible to everyone. Something else that you can use hyaluronic acid. Hyaluronic acid typically is very, very lightweight. It does bring more water into that area. So not only is reparative, but it's going to actually protect that barrier much quicker. So to me, in a dermatology office, that's what we find the most common misconception is the fact that you actually have to use some type of moisturizer for most patients. In terms of ingredients that what we have for acne, a lot has changed over the last 50, 60 years. But the one constant that continues to evolve, or at least be present all the time, is benzoyl peroxide, BPO. So benzoyl peroxide comes in various concentrations. The highest concentration is really 10% that does dry out the skin, and we have something as low as 2% that's less drying to the skin, but may also be less effective. The best range for most people, both young and mature skin, is about 4%. For those younger patients who have a lot of oil production, thicker skin on the face, neck, or body, a 10% works incredibly well. When people get acne or chest acne, especially during the summertime, there's a company called Penoxyl, and they create this bar that works incredibly well. It's a 10% benzoyl peroxide. For those when we're treating the face, let's say in the wintertime in a drier climate, we're going to use a lower percentage, like a 4% that comes from over the counter. That's on Penoxyl again, or you can get something from your dermatologist. What we find is with these varying percentages, there's no bacterial resistance that occurs to benzoyl peroxide. That is why it's been such a constant ingredient in most of these acne type products that we have, both prescription strength as well as over the counter. So it's an incredible ingredient. We use it every single day, and it's one of the favorite things that I do, that I use myself in addition to my family members.